Hi, this is Jonathan Wright, Dr. Wright, Court of the University of Michigan anyway, from the Tahoma Clinic in Tukwila, Washington. What can I do about those floaters in my eyes? Well, I'm going to digress for a moment to say that, our ancestors and predecessors were just as smart and just as dumb as we are. No kidding. And we did learn most of what we know from those who went before, didn't we? Which is one of the reasons I read a lot of old medical journals, because those doctors there did a lot of observing, and they came up with some very good ideas. And one of them was how to get floaters in the eyes to become considerably less and sometimes be gone. So here is a reading this old medical journal, and here's an article about floaters. And the doctor said that in a fairly large number of people, he had recommended a combination of 3 natural things. 1, something called choline, C-H-O-L-I-N-E. Number 2, something called inositol, I-N-O-S-I-T-O-L. And lastly, methionine, M-E-T-H-I-O-N-I-N-E. Choline, inositol, and methionine. And he had people take those 3 nutrients, which you can find in any health food store. By the way, you can find them in combination too, so hang in there. Anyway, he had people take those 3 nutrients, and over time, and yes, it did take weeks to months, but over time, the floaters would diminish, and sometimes they disappear entirely. Floaters, what's a floater? You look around and you can see those little things in your field of vision floating around. That's why they're called floaters. And if you get a whole bunch of them at once, it's a good idea to see your eye doctor. Might be some bleeding in the back of the eye. But if it's just those regular floaters and they're not bothering you too bad, or if the eye doctor said that's what they are, nothing much to do, here's what you can do. The combination of those 3 nutrients, choline, inositol, and methionine, is usually termed lipotropic factors. Nope, I didn't make that up. L-I-P-O-T-R-O-P-I-C, lipotropic factors. And it's in all the health food stores, sold by a couple of companies. I usually recommend that folks take at least 2 of them twice a day, and remember, they are quite harmless until the problem is substantially diminished or gone. And then one can do the usual, quit taking them, and if they don't come back, leave it alone, or use a low dose for maintenance, or if they do come back, find out how much it takes to keep them away. Now that choline, inositol, and methionine combination works against floaters, but as individual nutrients, these things do a lot of other good things around our bodies. So that's what we can do about those floaters, folks. And thank you for watching and listening.